Good morning, everyone, and thank you so much for joining us for the 2025 Digital Health Summit brought to you by the California Telehealth Resource Center. We are so glad that you could join us for today's session, eConsults, its digital lifelines, unleashing specialist expertise in the battle against America's chronic disease crisis, brought to you by three exceptional panelists. As you know, the theme of this year's event is the technology supercycle meets healthcare, leveraging digital health services to combat the chronic disease crisis and other challenges. Before we begin, I'd like to go over a few tips to help you navigate the conference platform. Next slide, please. The session is purely for informational purposes. CTRC has no relevant financial interest or arrangement with any organizations related to commercial products or services discussed during the summit. Next slide. Just to note that you do have to register to join each session, so if you haven't already, we're going to drop a link in the chat, and we hope to see you in our other sessions later today. Next slide. You can use the Zoom functions to ask questions, post comments, and connect with fellow attendees. Use the chat feature to interact during sessions. The session is being recorded and will be posted to the CTRC website or YouTube channel by the end of the month. If you encounter any technical issues, reach out to a member of the CTRC team on the platform or contact us at caltrc@ochin.org. Next slide, please. We'd also like to thank our funders, the U.S. Department of Health and Human Services and the California State Office for Rural Health. They are supporting this program and this digital conference. We would also like to acknowledge the contributions of our co-sponsors, the California State Rural Health Association and the Insured the Uninsured Project. And now I'm going to have the distinct honor of introducing our three panelists. First, we have Dr. Julia Tsay, the Associate Medical Director at Ravenswood Family Health Network, as well as her colleague, Moses Taufalele, the Referrals Department Supervisor at Ravenswood Family Health Network. Finally, we have Debbie Kim, the Digital Health Program Manager over eConsults at Stanford Healthcare. All three of them have put a lot of work into this panel, and we are exceptionally grateful to them for their time today. Next slide, please. And before I hand it over to our panelists to share all the wonderful insights they have for us, I want to set the stage for why we're having this conversation today. We are at a pivotal moment in healthcare. Across rural and underserved communities, only 3 in 10 specialty care referrals are ever completed. That means patients are going without the follow-up care they need, and providers are left without the tools to manage increasingly complex conditions. At the same time, chronic disease rates are rising, wait times for specialist appointments are growing longer, and the cost of care continues to climb. Add to that a nationwide shortage of specialists, and it's clear that the current system is unsustainable. But our speakers are here to offer some hopeful and proven solutions for how to address these challenges. And with that, I'm going to hand it off to you, Debbie, to get the presentation going.
Wonderful. Thanks so much, Lydia, for setting the stage for us. As Lydia mentioned, my name is Debbie Kim, and I'm the Program Manager for eConsults over here at Stanford Healthcare. I'm part of the digital health team. I've had the wonderful privilege of working with Ravenswood Family Health Network for the past 3 years, and I'm really excited to tell you more about our collaboration with my wonderful colleagues. And so before I do, I just wanted to share a few insights about Stanford Healthcare. Next slide, please. And so for those of you who aren't already familiar, Stanford Healthcare is a tertiary and quaternary academic medical center, and we have a strong presence throughout the Bay Area. We're currently serving over 2.2 ambulatory visits and facilitate or operate more than 880 inpatient beds. And while we're really proud to serve such a large population, we do acknowledge that our impact can really be limited by the physical boundaries of our hospitals or by our clinics. And so this is really why our Stanford Digital Health team, in partnership with the Market Development Office and with wonderful support from our executive leadership team, have really wanted to find an innovative solution to see how we can really expand our footprint digitally. And our goal was really just to think about how can we break down these geographical barriers to really meet patients where they are at, really in hopes of eliminating those barriers to care, not only to really further and increase our equity mission, but just to really make sure that our patients are able to get the care that they need and deserve. Next slide, please. And so this is really where the concept of community e-consults came into play. But before I tell you more about our program, I wanted to first tell you more about the concept of e-consults. And so e-consults are a form of asynchronous care, and they're provider-to-provider written consultations for low acuity cases. E-consults are incredibly efficient, and they can be completed within 3 business days. And in our program, our Stanford specialists are actually able to complete it on average of 1.3 business days. So now if you compare this with the traditional referral, which could take up to months, as Lydia had mentioned before, when you think about the increase or rise in chronic diseases, which really has seen a decrease in access to specialty care and leading to longer wait times, e-consults can really be a no-brainer and really can act as that digital lifeline for these patients. And so e-consults has been really critical in transforming how we deliver care. And so just to tell you a little bit more about this workflow, it really first starts off at the primary care clinics, and where a patient will first walk into a clinic, they'll be able to see their primary care provider, and the primary care provider may have a clinical question. And so what they'll do is let their patient know, hey, I have a question that I wanted to double check with a specialist for. And so I'm going to send a question to the Stanford specialist, and I'll just double check with them, and I'll get back to you. So they'll send their question to the Stanford specialist. They'll be able to get their recommendation back from them. And the Stanford specialist will either recommend saying that the patient can be taken care of at the primary care level, or hey, the patient actually needs to come in to get their care within their specialty care. And so depending on the recommendation, the ordering provider will be able to communicate that recommendation back and will be able to manage their care from there. And so what's great about this approach, it's really streamlined and it's able to enhance that patient care and make sure that we're really able to utilize and optimize that specialty resource, making sure we're able to see that patient, the right patient at the right time. Next slide, please. And so I'm excited to share more highlights from our eConsult program. So we launched first in May of 2022, and we now currently have 6 partners. We have had over 1,600 eConsults since our program launch, and we've had 15 specialties that are currently offered. Of the e-consults that have been ordered, 80% of these cases have actually been resolved through these e-consults. And resolved means that the patients are able to actually be seen at the PCP level. And so this is a really significant achievement because this means that the patient can really avoid these unnecessary visits to these specialists since they've been able to get these resolved through e-consults. And about 18% of these cases have actually been converted or triaged through eConsult to be and recommended to be seen in person. And so what's great about these eConsults, as I mentioned previously, it really is able to extend that specialty support regardless of these geographical constraints. But we're really seeing these benefits go from the community providers as well as to the patients. And so we're really seeing not only the improved access to specialty care, but what's so important is really that respecting and enhancing that really important relationship with the patient and provider. We know that it's all super critical for that continuity of care, which we know is super important for those chronic diseases as well. It can really affect patient health outcomes. But also that primary care providers can feel more empowered to manage cases much more confidently. I've actually heard, I think Dr. Sayed mentioned more anecdotally that one of her providers now knows exactly what to do for patients who present with migraines just because of the e-consult that she received from one of our neurologists. And actually doesn't even need to send any more e-consults based off of that. And we love hearing those types of cases because then our primary care providers now know what to do and feel much more confident providing care to their patients. And so for our patients, what's great is that they're able to, of course, get that increased access. They're able to get that care much faster than they would with a traditional referral. But it makes it much more direct, really eliminating that avoidable daisy chain of care. for that follow-up care. And then also, especially for a lot of those patients who face challenges with navigating the healthcare system, especially those who may be impacted by social determinants of health or chronic diseases. It can really help eliminate those barriers and get them the care that they need right away. Next slide, please. And so, as I mentioned with you all, we started with Ravenswood almost 3 years ago now, which I can't believe how fast time has flown. But they were actually our first community health partner to start with us. And so we have leveraged a third-party platform that does allow us EMR interoperability, which has been really critical to the success of this program. And we actually started this program with 7 specialties and now expanded to 15. And I hope to continue to grow this program even more so that we're adding more specialties in the future. But we really take our cue from our partners. We've heard directly from Dr. Say and Mo, who've been able to tell us, what referrals are super impacted or what the needs of the providers and patients are. And we're able to listen and hear, hey, these specialties are really needed. And then we work with our specialists who are really passionate about being able to provide care for community patients because they don't want patients to be waiting months for their care either. And so they are also working hard to increase, capacity to be able to offer these eConsults to community patients as well. And so we're excited that we've been able to expand and grow this program and are looking forward to continuing it as well. And so I can tell you a bit more about what their growth has looked like on the next slide, please. So we've been able to see, this is a graph of what their growth has looked like really over the past several years. And they have seen significant uptake with over 1,200 eConsults. And what's amazing is that there's 35 unique providers who are really driving this adoption. And it really shows what, amazing, smaller group of providers have been able to have such a huge impact when it comes to that increase in access to specialty care and are having, such a huge impact on patient lives. And so of these eConsults, 81% of them have actually been resolved. So again, being able to be seen at the primary care level and not needing that in-person visit to the specialist. And so to me, this really just shows that there's such a strong demand for this service at Ravenswood, as well as for community health centers. And I think really just shows that this is really great proof of concept that this kind of partnership really works, but also is really needed across the community. And so one last thing I wanted to leave you all with before I pass it on to my colleagues is that upon finalizing an eConsult, we do actually ask providers a survey question and asking them, if this eConsult program wasn't available, what would they do? And on the next slide, actually, we'll be able to tell you a bit more. Do you mind going to the next slide, please? And they actually mentioned that, so of the 1,200, Ravenswood providers said that of the 1,200, over 1,200 eConsults that submitted, 64% of Ravenswood providers, 64% of these eConsults would have required an in-person visit if this program didn't exist. And so, as I mentioned previously, this really highlights the importance of this program, but it also demonstrates that this is really a partnership that has grown organically over time, but that these types of partnerships can really enhance care, enhance access to specialty care, can reduce wait times, it can reduce the burden of referrals on health systems as well. But I think just really shows that this is, as I've mentioned, valuable proof of concept for similar collaborations in the future. And so it just has been such a wonderful collaboration. And so with that, I will actually pass this off to my colleague Mo, who will be able to tell you more about Ravenswood and the impact it's had on their health center. And so with that, Mo, I'll pass it to you.
Thank you so much, Debbie. My name is Moses Taufalele. I also go by Mo. I am the Referrals Department Supervisor at Ravenswood Family Health Network. Just to give you guys a little bit of a brief history of our organization, in 2001, Ravenswood Family Health Center opens its first temporary location in East Palo Alto, a low-income community in the Bay Area in which I grew up. With much support from contributors and community partners, our clinic grew from portables into a permanent facility in 2015. Since then, we have grown into a network after merging with Mavie Community Health Centers. We are Service Area 111, Ravenswood Family Health Network today. In the next slide, you'll get a better idea of who we serve. With 4 sites spanning over 2 counties, San Mateo and Santa Clara, we service the underserved populations. That's over 21,000 patients. As you can see, a large percentage speak another language, mainly Spanish, and a few other native languages such as Tongan, Samoan, Tagalog, or Vietnamese. With about 90% of our patients at low income status, they qualify and are enrolled in Medicaid, Medicare, and other county programs. And if you look at the other data below, you'll see that 12% of our patients seen are diagnosed with diabetes, which is higher than the California state average, about 9 to 10%. Next slide, please. As some of you already know, providing care to underserved communities comes with even greater challenges. For patients, they face language barriers, lack of transportation, and difficulty navigating the healthcare system, just to name a few. For the providers and their care teams, they face increased walk-ins and appointment requests, just to discuss a referral question. For our referrals team, we have difficulty reaching the patients. It affects our communication efforts to provide these instructions and updates on the referrals in a timely manner. This often leads to an increase of pending and incomplete referrals. And even though we are located in such a resource-rich part of the Bay Area, we do face more challenges like limited options with health plan networks and an increase of redirected referrals due to the limited capacity and availability. Now with eConsults, everyone benefits. Patients have greater comfort with their care and have greater trust with their PCP. Our providers get direct access to now 15 specialists, and reports are readily available in 3 business days. For our referrals team, we can advise our referring providers when we're facing a limited capacity referral or denials Since our partnership with Stanford has grown, we've been able to give more access to quality care in a timely manner. And because of the provider's direct access and the quick turnaround, patients are able to get the medical advice and recommendation they need from their PCP. As a result, the patient-provider relationship has strengthened, as with their trust with our organization. This is a really important part for our patients who have a limited understanding of their health. It creates that bond with our patient and provider in our organization, as I mentioned. eConsults has given our referrals department a great alternative when outgoing referrals get denied or redirected. And even if we're dealing with issues with coverage or health plan or lack thereof, this does not involve billing with the patients. So through this process, we've been able to avoid unnecessary referrals, decrease costs, and saving time. Next slide, please. And I'm just going to introduce or just give us a little background of our referrals team. You can go to the next slide, please. We have about 11 team members. And what we do is process the outgoing internal referrals and also radiology orders. We do take care of our Medicaid and Medicare patients, and we really just serve our community by being the bridge from primary care to outpatient specialty care. Next slide, please. So here's our outgoing referral process from start to finish. The integration of eConsults workflow fits in seamlessly. So the referral lives inside our outgoing referral work queue. However, we do not process the referral. It lives there so that myself or my manager can monitor the progress, and we pretty much will track it and see if it will be completed in 3 business days. If for some reason we do not see that it has been completed, we'll take the next appropriate action and communicate with our partners at Stanford and our third-party vendors. Next slide, please. Now, here's some data. What you see is a volume of outgoing referrals versus eConsults in 2023. This includes only 10 of the 15 specialties provided through this program. And I do want to highlight dermatology as one of the highest utilized service for eConsult. This specialty is highly impacted at many sites at both counties. For example, in one county, the specialty has been closed off from accepting referrals, which results in a redirect. In another county, the service is available, but there's just about a 6 to 8 month wait just for a consultation. And out of those total referrals for dermatology, 22% of those are eConsults. In addition to that, we do have endocrinology that's also impacted, a very important specialty for our chronically ill patients. Over 20% of those referrals are eConsults too. We did also find some interesting data too with our infectious disease referrals. As you can see those numbers there, about almost 50% of those are eConsults. Next slide, please. So leveraging eConsults has become the norm for our team. We really created different ways to communicate by really creating smart phrases to help our team promote this wonderful program. The dot phrases help us communicate with our back office teams, our providers, to recommend this alternative. And this really helps to drive down our work queues, lessen the burden of countless calls and messages to patients. And more importantly, this tool allows our team to advocate for the patient. And now I would like to pass this along to my colleague, Dr. Say.
My name is Julia Say. I'm a family medicine physician and associate medical director of family medicine at Ravenswood. I would like to provide give a context about the provider experience using eConsults. Next slide. So our current team consists of 22 clinicians, physicians, NPs, and PAs who provide care to adults, and they are enrolled in eConsults. The specialties represented are family medicine, internal medicine, and OB/GYN. Our clinics are completely separate from inpatient or specialty clinics, so we don't have a direct affiliation with a hospital. And since we lack this type of relationship with specialists, it can be challenging sometimes to get answers from specialists in a timely manner. We can't really do curbside consults unlike PCPs who might work in a larger system. eConsults have helped overcome this barrier by strengthening the relationship between PCPs and specialists in their timely communication with recommendations for our patients. Next slide. Providers who use eConsults have really enjoyed it because they're a really great learning tool, as Debbie mentioned before. Stanford created eConsult templates that they share with us, in which they list diagnoses that are appropriate for eConsults and also list recommended tests and guidelines of what to include to make it a successful eConsult. This includes clinical pearls from a specialty about the diagnosis. So these templates are really helpful because if they often include certain recommended tests to have before you even place the eConsult, and that can avoid having more back and forth with the specialist and the PCP. Next slide. eConsults assist with both acute and chronic disease management, but they've been really helpful for our patients with chronic diseases. And I want to give some examples of eConsults from the providers in our clinics. This one is focused on type 2 diabetes medication management that was sent to endocrinology. In this case, we have a 41-year-old patient who has been on metformin and mixed insulin Humulin 70/30, 48 units in the morning and 52 units at night with an A1C of 7.3. The PCP's question is, should I switch my patient to a different type of insulin? I'd like to continue metformin. The endocrinologist advised that that it may be good to start a GLP-1 receptor agonist, such as Mounjaro, and they give recommendations on specifically how to initiate it and how to titrate that dose. So 2.5 milligrams weekly for 4 weeks, and increase by 2.5 milligrams every 4 weeks until you get to the maximum dosage. In addition, they say that the patient's health plan may require the patient to try Trulicity or Ozempic first, which are alternative GLP-1s. They agree with the PCP recommendation to continue metformin, and they recommend continuing the current insulin regimen for now until the PCP can increase the GLP-1 agonist dose with the goal of reducing the insulin dose as their blood sugars improve. They also include a contingency plan. If the total daily insulin requirement falls below 50 units, the PCP can try prescribing once daily basal insulin and using glipizide in addition to metformin and the GLP-1 agonists. So this is an example, not only shows how the specialist gives a recommendation on medication change, but also provides some practical tips, in this case, to avoid a burden of prior authorization that often comes up with these medications. So next slide. This is an example of eConsult and hypertension, which is another common chronic disease that we see. And it's a great example of how PCPs are given multiple different steps to try before advising that they send a patient to see the specialist. So this is a 68-year-old patient with multiple comorbidities, hypertension, COPD, on home O2, sleep apnea, diabetes, obesity. The PCP question is that the patient is on lisinopril, labetalol, and Lasix. I would like to add additional medication, but previous trials at amlodipine and hydrochlorothiazide, the patient did not tolerate well. Would appreciate any additional recommendations. So nephrologist recommended screening for secondary causes of hypertension, and they listed certain labs, and to consider repeating a sleep study to titrate the BiPAP on for the sleep apnea. And after checking the labs, they would consider adding spironolactone and titrating to the maximum dose of 100 milligrams daily, and reminding us to check potassium in the lab work after each dose adjustment. They would also consider trying chlorthalidone or a loop diuretic, or increasing the furosemide to twice a day dosing, or even considering switching to torsemide. And if all that fails, you could try hydralazine. So many steps listed in that recommendation. And then if this is not adequately treating the hypertension, then refer to the specialty for further medication adjustment. So in order to carry out all these recommendations, it's very likely that a PCP would need at least 5 additional patient touches, either provider visit, a nurse, definitely lab work. And it's better to do this in a primary care setting where you have that relationship with the patient. The patient's more likely to come back to the PCP office than the specialist office. And overall, the cost of care at a PCP office is lower than at specialty clinic. It also it supports continued use of telehealth visits. Typically, we have been able to discuss these recommendations with patients by telehealth visit to be able to provide sooner follow-up, and also incorporate the use of blood pressure monitoring using a home device. So next. Overall, PCPs have enjoyed using eConsults due to the short turnaround time for specialty response and additional benefit learning through eConsults. Feeling like they can do more for the patient can lead to greater work fulfillment and hopefully help combat provider burnout. eConsults show the importance of the role of PCP in being able to carry out specialty recommendations, and it's one way that we can invest more in primary care. Next slide. The eConsult program has demonstrated how we can use technology to help improve access to specialty care in the primary care setting. It's highlighted the essential role of the primary care workforce and the need to continue to find ways to support PCPs. PCPs often address multiple issues in a given visit and can leverage the relationship they have with their patients to ensure that they follow through on recommendations. It allows specialists to see more complex cases, and patients win by having fewer barriers to specialty care. eConsults benefit the healthcare system by addressing long wait times to see specialists and lowering overall healthcare costs through the PCP. The eConsult program has helped strengthen the relationship between our clinics and Stanford. This model can help build stronger relationships between hospitals and primary care community. As a FQHC serving patients who typically have fewer resources, we're really grateful to have this opportunity to collaborate on a service that increases access to care for our patients regardless of their insurance status in both counties that our clinics serve. Next slide. And then, thank you. Pass it back to Lydia.
Thank you so much for that wonderful presentation. I am working on getting my video spotlighted again. Thank you so much. That was incredibly informative and inspiring to see how eConsults are really making a difference for patients and providers. And to hear that it's been going for 3 years and had such great success over 3 years is really cool, and excited to see what the next 3 to 10 years bring for the program. So we had a few questions in the chat. So I believe we're going to start with one of those. And so Debbie, I think you're going to at least start tackling a question of how are consultant specialty services instructed to bill for different eConsult evaluations to ensure they continue to build revenue that supports expanding their availability and care delivery.
Yeah, definitely. Great question. And hopefully I'm able to answer it if I'm understanding it correctly. And so when it comes to for Stanford on the specialty side, I mean, we don't necessarily see this as you know, a huge revenue maker for us. I mean, this is really our way to increase our health equity mission and just to make sure that we are able to expand our care into the community. So I think for us, we're wanting to just ensure that the community is able to get you know, high quality care, and you know, that our community providers are able to get that that we're able to fill any gaps in care as needed. And so for us, we also are seeing, you know, really high referrals, volume of referrals coming into Stanford just in general as well. And so this does also help, you know, with making sure that, you know, we are also decreasing, you know, our referrals too. We do this within our internal Stanford hospital as our healthcare system as well too. And so just to really also make sure that we are decreasing our referral queue and making sure that, you know, we're giving care to the patients who need to be seen in person, and then also, you know, getting care to patients more immediately for those who have those lower acuity cases that can't be answered by an eConsult. And so hope that answers your question, but really, we really just see this as a way to increase kind of our health equity mission and just to make sure that we're getting care into the community much faster.
Thank you so much for that response. And I kind of have a follow-up on that question as well. So when maybe thinking about the reimbursements or the payments or the billing side of it, maybe there's not the funding coming in that way, or that's not a prioritization. But I imagine, just based on some of the statistics you all shared earlier, that there is a definite return on standing up a program like this. I mean, 64% of those referrals avoided having to do an in-person. And maybe that gets care to people quicker. Maybe that helps an intervention happen earlier in terms of how someone's chronic disease is being managed. Have you all looked into maybe have these eConsults avoided maybe emergency room visits, or maybe a more acute kinds of care because there was this intervention that happened earlier? Heard any stories of, because this thing happened, I didn't have to go to an ER, or I didn't have to wait months and months, and things grew more acute?
Yeah, and Dr. Say, I don't know if you have any from Ravenswood. I know I know of some that I've heard from Stanford, but I'll pass it to you first if you have any.
There's definitely, I can think about it from the diabetes perspective that getting that patient, you sooner care at the PCP level versus waiting months and months for an endocrinology visit, that that allows the PCP to manage their blood sugars better, without having to wait for it to get worse until they end up in the emergency room with a complication of diabetes. So that is an example of how we can avoid certain conditions getting worse. Overall, I mean, the PCP does take into account, before they submit an e-consult question, they are triaging to make sure that this is not um, an urgent issue at the time, and then meeting the criteria for like appropriate e-consult.
Yeah, and one thing I'll just add, one patient story that we heard from a patient who was traveling for the holidays was actually up in more really Northern California, but I think more towards the Eureka area. Maybe it was more in a rural area where there weren't specialty care around them. And so they were a patient at Stanford, so they had reached out to their primary care provider via telehealth. And they had mentioned that it was right before, I think it was maybe New Year's Eve. And so just in general, it's just really difficult to get care. They had a really severe infection in their hand. So what they had mentioned to us, and one thing that I just, really shows the impact of this program was the infectious disease specialist was able to prescribe, whatever antibiotics or whatever care that they were able to, or give recommendations to prescribe whatever medication that the patient needed. And so the patient was able to get the care and medication they needed. And they really have just said that this, the infectious disease provider really saved my hand. They would have lost their hand, had it not been for this e-consult, especially being in a more rural area where there weren't healthcare centers around them, and on, a holiday where it's just more difficult to get care. And we're also, we know that EDs and other areas are just more crowded during those times as well. And so it just kind of just shows, I think, especially in some of these areas where, care is more difficult to get. And, we're talking about different barriers. I think he had mentioned that it would have to be driving. He would have to drive maybe like 6 hours to get to the nearest one. It just really shows, how much this can help when it comes to just access to care. And not even in just these kind of more immediate cases, right? We're seeing this also with just primary care or whatever visits as well. And so I just thought that really stood out to me. And just, this is, he's just was so grateful. And, just made sure he's like, please let, your infectious disease specialist know, because it's made such a huge impact in my life. So that was great to hear.
Yeah, what an incredible story, and to know that there's thousands of patients who benefit from that program, and the providers as well who've been able to have access as well. We have a couple more questions in the chat that we're going to try and get to. So we have one question that says, how do you ensure providers use this essential resource appropriately? Are there any metrics or expectations to ensure appropriate utilization?
So we meet regularly. Stanford, our Ravenswood team and Stanford meets regularly to review the statistics on the e-consults that are submitted, so that we can see which specialties are being underutilized, which specialties are more utilized. There is a metric that that is in the survey that's filled out at the end of the e-consult that the PCPs respond, how useful how would they rate this e-consult, and then the specialists also can rate the e-consult. So across all the specialties, we've seen a high rating of the PCP question from the specialist, which is great. My role as a clinical champion for the adult medicine is that I encourage the providers to use the resource to find ways to is there a way that we can enhance the patient care by using this more? So often it comes down to looking at the which providers are using it versus are not using it, and getting the feedback from those who are the super users and those who are not using it. So I think that also addresses the Derek's question as well.
Yeah, I would love to hear a little bit more about sort of the implementation journey, because I would imagine 3 years in, you have learned some lessons about how to maybe reach some of the people who are not utilizing the program as much, or maybe a little skeptical. So anything that you can share on the implementation and sort of change management of standing up a program like this would be great.
Yeah, the first thing is that the way that we order the eConsult mirrors how we order a regular specialty referral. So it doesn't change how the providers have to submit an eConsult. So I think that it was the biggest thing about implementation. The second thing is having a clinical champion who can be available for any questions about the eConsult program on site and bring up updates at regular meetings. So I function in this role, and I share any updates about the eConsult program, share the statistics with the team, and share examples of eConsults that have been submitted from our group, so that it encourages other members of the team to think of, oh, okay, this is how I can also utilize it, and how it can help with my business as well.
And just to add to that as well, as Dr. Say said, we are very intentional about making this be as low of a lift for our partner organization providers as possible. And so we really do try to understand what the workflow is for their referral workflows, so we can mirror it. But I know that Mo is probably too humble to say this, and so I'll say it for him. The referrals team has been incredible in this, and one implementation piece that I think has been great, and I'll also shout out Kelly Fuentes, who's also on this call as well, has just been the referrals team has been helping redirect referrals that have high wait times. They'll actually, and I know Mo had already presented on this, and they've created a smart phrase and have worked with providers, but we've actually used this tactic and have suggested this across to a lot of our other partners as well, and have been just such a great and innovative way that we have seen utilization be increased. So a lot of the providers are super busy and, just aren't maybe necessarily thinking about it. And so I just really wanted to shout out the referrals team here, along with Dr. Say, who's just been a remarkable champion. Can't really say that enough. Having a provider champion has been, who is able to really speak to it. This team has just been absolutely amazing, and kind of thinking of new ways constantly on how to increase utilization as well. So I'll just wanted to shout out to this team, because they've been just amazing partners to work with.
Absolutely. And that's a great positive note to end on, just that all it takes is a couple of teams, a few people really working closely and intentionally to really make a difference across a pretty large area of California at this point. So congratulations on such a successful program. And thank you so much for sharing the work that you've been doing with us and our attendees. So we are going to do our final housekeeping items, and I just want to thank our speakers again for such an informative session. You can go to the next slide, please. For anyone on the call who's interested in some ongoing support from CTRC, make sure to check out our website at caltrc.org, where you can find events, webinars, on-demand resources, and more, or you can reach out to us directly at caltrc@ocean.org. Next slide, please. And if you're interested in attending more events, CTRC is co-hosting our first Healthcare AI Bootcamp with virtual and hybrid sessions from June through August. Registration will open on June 1st, and you can access that registration through the link in the slide, which will be accessible once this video is posted at the end of the month. You can register for the AI Bootcamp at the link that was just dropped in the chat as well. Next slide, please. CTRC pushes out a monthly newsletter, so stay in the know and subscribe to that to receive the latest updates on available trainings, webinars, and on-demand resources. And the last thing we have for you today is we would like to invite everyone to complete our short exit survey. Next slide, please. We want to ensure we are meeting your needs, and if you have any feedback or ideas, please feel free to let us know via the survey. And with that, we are wrapping up right on time. We really appreciate all of your responses, and thank you so much for attending. And I just want to say one final thank you to our speakers, to our funders, our sponsors, and all of our attendees. None of this would be possible without you. So thank you, and we hope to see you at the rest of our sessions.